More than 4 months after the coronavirus first exploded in the United States, several states are seeing new spikes in cases. Texas reported more than 10,000 new cases for the fourth day in a row on Friday. The state has given public schools the okay to remain closed in the fall. The virus has killed more than 3,800 people in Texas. Florida also added more than 10,000 new cases to its tally. Parts of the state have issued mandatory curfews to get people off the streets. The jump in cases has convinced retail chains like Lowe's and Home Depot to join a growing list of companies requiring customers to wear face masks in their stores nationwide. For more on all of this, I am joined by Dr. Amesh Adalja. He's an infectious disease expert as well as a senior scholar at Johns Hopkins University Bloomberg School of Public Health. Dr. Adalja, how can officials in these states seeing a spike in new cases address the issue and start to get some control over the virus, especially when public health experts are saying one thing and then local officials, state officials, and national officials might be saying something else?
This has really been the story of the entire pandemic, conflicting information from different levels of government that have made it very hard, if you're a member of the public, to know who to believe, who to trust, and seeing shifting guidance from different places. And that's not how you should manage an infectious disease emergency. What people should be doing is listening to public health authorities, because they are the ones with the expertise on how the disease is spreading in their area and what activities are promoting spread and which activities are relatively safer. And that being said, you're going to see lots of businesses require face coverings to come in, because this is being seen as increasingly as the currency for moving forward. And it is something that if there are people that are sick that are going out, and clearly they are, or we wouldn't be getting this type of spread in some states, a face covering, not just a face mask, but even a face shield, may provide some benefit for preventing the spread and getting this under control.
Well, earlier this week, the Trump administration instructed hospitals to no longer report daily COVID-19 data to the Centers for Disease Control. Instead, the information is now supposed to be sent directly to a database in Washington. Tell us how you feel about that news, and do you have any concerns about this information bypassing the CDC?
We know that the CDC is the premier public health agency in the country, probably even the world, and that it's their guidance that is very, very critical to managing any kind of infectious disease emergency. But what we've seen from the very beginning of this pandemic is a marginalization of the CDC, where CDC experts are increasingly being forced to think about whether their guidance is going to be something that conflicts with a narrative from the White House versus whether it actually is reflective of reality. And I think that's a poisonous atmosphere, and it's really further evidence, this new move, of how the CDC has become sidelined and isn't able to do its job. And I think this is something that we're going to see the consequences for a long time.
Well, I also want to ask you a little bit about testing for COVID-19. Many of the available tests can take several days to produce a result. We heard the governor of Texas speaking out against this problem today. How does the delay affect our ability to actually get the virus under control?
It actually makes it almost impossible to get it under control. If it takes 7 days or even longer in some places to get an outpatient test result, how can you actually do contact tracing and case investigation? It makes it almost, futile to do that. So we have to get turnaround times down to probably 1 day, ideally. We can get this test back in a couple of hours in the hospital, but there's no excuse for what's happening in outpatient testing facilities where people have to wait in a car for 8 hours to get a nasal swab. It doesn't have to be this way. In those states where this is happening, they had months and months and months to try and figure this out. And clearly, there wasn't political will or an understanding of what was going to be needed as we move forward in this pandemic. The virus isn't going anywhere, and testing needs are going to continue to be a major issue as we move forward until we have a vaccine. So we have to get this right. We need to be able to be tested for this, just like we can get tested for HIV or even get our blood pressure taken. We shouldn't have to wait 7 days. It's really unacceptable, and the White House task force has to really work with suppliers to make sure that this can happen.
Well, as you're well aware, there's a nationwide debate on whether schools should be reopened in the fall. President Trump is pushing for students and staff to return to class across the country. Critics argue that it's dangerous, especially with a number of states seeing a spike in new coronavirus cases, and feel like in this instance that the White House is edict that local and state governments should be making more of the call instead of the national government. Seems to be falling on hollow ears in this instance. As a medical professional, I'd love to have you weigh in. Do you think that schools should reopen for in-person learning? Should this be something that happens only in states that see a negative or a downward trend line? Or is the president right that it's just too important to our nation's economy and to our nation's young people to get them back into school?
It's absolutely a priority that we get schools open, and we have data that support the role of children not being to accelerate spread, and they tend to be spared from the severe consequences of disease. And we have lessons from other countries, from our daycare centers that have been open in some states like Wyoming, Idaho, and Montana that have opened it. But you can't really think about opening schools in a safe manner if you have an outbreak out of control in your region. And I think this is why it has to be done at a school district by school district level. What's going on in your school? What in terms of the hospitals, the hospital capacity there in your school district? What's the personal protective equipment status? How easy is it to get tests? Because you know that we're going to get cases in schools. We know we're going to get exposures, and we do have vulnerable teacher populations. This can be done, but it needs to be done with the whole context of what the outbreak is doing in your area. And there may be places where it's very hard to do this, and there may be places where it's relatively easy. So I don't think this is going to be a one-size-fits-all type of solution. It's going to be driven by the local dynamics and resources of each school district, and I think that's how it should be.
What steps do you think that these local school districts can take to make sure that they are protecting the lives and safety of their students as well as their adult faculty, staff, and other workers?
What they need to do is come up with a comprehensive plan for how they're going to deal with cases, how they're going to deal with exposures, and think about how they can change the physical layout of their school in order to make social distancing easier. Do they reduce class sizes? Do they do more classes outside, some in the gymnasium? Do they have some ability for distance learning if there are people that are more vulnerable there, including teachers? And then you have to really think about all the places where you can decrease the risk. You know the risk isn't going to be zero, but you can reduce the harm of the virus by taking simple principles that maybe they learn from other countries, maybe they learn from other states, and try and do this. It's going to be a rough school year no matter what, and you have to expect that we're going to see cases, and we're going to have schools that have exposures and have to modify their operations. That's just a simple fact. So the question is now, can we get schools ready and prepared, and the parents ready and prepared to deal with this really different school year that we're approaching?
All right, Dr. Amesh Adalja, thank you for joining us.
Thanks.